Today, we are going to break down something that can be really confusing for so many people, the staging system for endometriosis. We're going to demystify what those stages actually mean. But first, let's just jump right into the central puzzle of this condition. How on earth is it possible for someone with so-called minimal disease to be in absolute debilitating pain, while someone with severe disease might not even know they have it? To really wrap our heads around this paradox, we have to do a quick refresh on what endometriosis even is and why doctors needed to classify it in the first place. Okay, so here's the deal. With endometriosis, tissue that's a lot like the uterine lining starts growing in places it just doesn't belong, like on your ovaries, your bowels, or all over your pelvic walls. Now, this tissue still thinks it's in the uterus, so it acts like it. But since it's trapped outside, the blood has no way to leave your body. And that's what causes all the trouble. Inflammation, pain, and eventually cysts and a lot of internal scar tissue. What makes this condition so tricky is that it looks completely different in every single person. For one person, it might be just a few tiny spots. For someone else, it can be this widespread disease that literally glues organs together. This huge variation meant that doctors really needed a standardized way, a universal language, to describe what they were seeing. And that leads us straight to the most common tool they use, the American Society for Reproductive Medicine Classification System, or ASRM for short. Just think of it like a universal map that helps surgeons document exactly what they find and where. Okay, this is a really important point. Endometriosis can only be officially staged during surgery, usually a keyhole surgery called a laparoscopy. So during the procedure, the surgeon goes in, takes a look around, and basically acts like a detective, assigning points based on the evidence they find. So what are they scoring? It pretty much boils down to three key things. First, the endometriosis implants themselves, where they are, how big they are, and how deep they've managed to grow. Second, any cysts on the ovaries, which you might have heard called chocolate cysts. And third, the amount of scar tissue, or adhesions, that have formed. After they've tallied up all the points, that final score puts the endometriosis into one of 4 distinct stages. So let's just walk through what each one looks like. We'll start at the beginning with stage 1, which is called minimal. This is for a score of 1 to 5 points. As you can see from this diagram, we're talking about a few small, surface-level implants. At this point, there's very little, if any, scar tissue to be seen. Next up is stage 2, or mild, and that's for a score between 6 and 15. At this point, the surgeon is seeing more implants than in stage 1. And, this is a key difference, some of them have started to dig deeper into the tissue, though there still isn't much in the way of adhesions. Now we're getting to stage 3, moderate. The disease is definitely more widespread here. You've got lots of deep implants, you often start to see those chocolate cysts on the ovaries, and the scar tissue becomes much more obvious. And finally, we have stage 4. Severe. This is the most advanced stage. We're talking large cysts and a whole lot of dense, thick scar tissue that can really distort the anatomy of the pelvis. It can sometimes even fuse organs together, which is sometimes called a frozen pelvis. So just to put it all together in one place, here's a quick summary. You can clearly see how the 4 stages progress, tying the point score directly to what a surgeon would find, from just a few superficial spots in stage 1, all the way up to those large cysts and dense adhesions in stage 4. But now, we need to talk about the single most critical takeaway from all of this. This is the big limitation of the system, and it's the answer to that puzzle we started with. Let me say this as clearly as I possibly can. The stage of your endometriosis does not predict your level of pain or your symptoms. A low stage doesn't mean your pain isn't real. And this slide just perfectly explains why. On the left, in the stage 1 paradox, you could have one single tiny implant. But if it's growing right on a major nerve, it can cause unbelievable pain. Now look to the right. You could have widespread stage 4 disease with tons of scar tissue that just happens to miss all the sensitive nerves and feel very little pain. It's all about location, not just volume. So if this system isn't a great way to measure pain, you're probably thinking, well then what's the point? Why do we even use it? It actually serves 2 very important clinical purposes. First, it's a huge help for planning surgery. If scans suggest you might have stage 4 disease that involves the bowel, the surgeon knows they need to book a longer surgery time and maybe even have a bowel specialist on standby. Second, it does give some clues about fertility. The intense scarring in stages 3 and 4 can physically block or twist the fallopian tubes and ovaries, which can make getting pregnant more difficult. So what's the final takeaway? Your endometriosis stage is a clinical map. It's for your doctor. It helps them plan treatment and talk about fertility, but it is not a measure of your pain. It's not a judgment on your experience, and it is definitely not your story. What you feel, your symptoms, that's what truly matters.